Hey, good afternoon, everybody. This is Dr. Osborne and coming at you with another segment on Facebook Live. And just want to take a few minutes to make sure everybody can hear me as we're going through this. Last time we had some volume issues. So if you are hearing me coming through loud and clear, just click your like button for me or type into your comment box, just type in a big yes for me, and that way we know that housekeeping is done and I'm coming in loud and clear. Okay, looks like the volume is on. So let's dive in. So today's topic, I wanted to talk a little bit about the studies that have been coming out on blood sugar, and diabetes and the gluten diet. There was recently a publication in the American Heart Association. Actually, it was at one of their conferences, and some doctors had pulled some research together from what are called prospective trials. And I wanted to find what that really means. These prospective trials are where we take data that has been collected, and in this case, data that's been collected about the last 30 years. And this type of data is dietary data. What's going on is we're asking patients about their diet, and they're filling out dietary surveys, and then we go back through and crunch the data and try to understand if there are any disease risks associated with different types of diets. And so what came about in this recent prospective paper was that people who were eating less gluten had higher tendency toward development of diabetes, at least according to the authors of this new report. And I want to be very, very clear that a low gluten diet does not contribute to greater diabetes. And I want to also be very clear about what they studied. They did not actually study patients who were following a gluten-free diet. They actually analyzed surveys of people, and the people that ate the least quantity of gluten, based on the surveys, based on what they could tell, had a greater tendency toward blood sugar problems. Now, it's very, very hard to make any type of clear or concise statement from looking at 30-year-old surveys about what somebody ate. Because first of all, the biggest flaw is that people don't remember what they've eaten within the last 3 days. This has actually been really well studied. When we try to ask people how their diets have been in the last 3 days, the vast majority of people don't remember what they ate yesterday. And they have a very, very difficult time accurately recalling what they've eaten in the last 24 hours. So I want to be clear that this type of study, first of all, has its own flaws. But second of all, this study was not actually done on people who were gluten-free or people who had celiac disease or people who were following a strict diet. It was also not done on people who were necessarily following let's just say, a gluten-free diet where they were eating a lot of processed gluten-free foods. So there's really no conclusion that can be drawn from this type of prospective data. And I only wanted to get online and talk about it because so many websites are reporting how a gluten-free diet actually increases the risk for diabetes. And it's just a falsity. It's just not true. And the data they're using to support that claim is far from accurate and far from true. So if we really want to talk about the connection between gluten sensitivity and blood sugar problems and diabetes, we should dive into the connection, first of all, between type 1, which is a form of autoimmune diabetes, type 1 diabetes, and exposure to gluten. It's very well established in medical literature that those who have type 1 diabetes, one of the triggers can actually be gluten. One of the other triggers can actually be dairy. So dairy and gluten are actually triggers for autoimmune type 1 diabetes. Number two, if we look at people eating lots of gluten with gluten sensitivity, and maybe we're not talking about celiac disease directly, we're talking about non-celiac gluten sensitivity, we look at the impact that grain, not just gluten, can have overall on blood sugar. So blood sugar itself is affected in a bad way, in a dramatic way, when eating processed grains. And I say processed grains because if you go to the gluten-free aisle and start buying what people are calling gluten-free, the rice breads and the corn chips and all the things that contain grains, you're going to find those people are going to stay unhealthy because those foods aren't healthy. They're full of processed sugars, they're full of garbage, and they're not really all that great for us in the first place. So if you're going and you're omitting wheat, barley, and rye and replacing it with processed corn and rice and sorghum and millet, you're not really doing yourself any favors, and you're still going to gravitate toward higher levels of blood sugar because, one, there is a truth to when you remove whole grain from your diet, you are reducing your fiber intake. And if you don't add fiber intake from fresh vegetables or from nuts as a substitute instead, and instead you're eating highly processed junk food and highly processed grain-loaded foods, yeah, you're going to raise your blood sugar. Gluten aside, gluten has nothing to do with that component. It has to do with the processing of the food itself and the carbohydrate load of the food and how that can influence your body's insulin and how that can influence your body's glucose levels in your bloodstream. So very, very important to understand that ultimately, if you're trying to follow a gluten-free diet, but you're eating a processed, garbage-based, junk food-based, gluten-free, food aisle-based diet, yeah, your blood sugar is probably going to go up and you're probably going to have fiber problems and you're probably not going to restore your health. That's a no-brainer. I don't think anybody listening to this broadcast could really argue with that or could disagree with that. So all that being said, now that the air is cleared on that front, I want to take the time to answer some questions as they're coming through. So if you've got questions, make sure you just fire away in the stream here. So let's get to John has a question. If you eat rice flour, processed food, well, it's not really a question as much as it is a statement. He's just agreeing with what I just said. So yes, if you eat rice flour, processed gluten-free food, and junk, then diabetes is probably in your future. Let's see, Sharon Lynn Pearson. I presume Dr. Osborne is referring to eating gluten-free, but replacing with gluten-free food like bread, baked goods, etc., which he has said are mostly junk carbohydrates, which of course can lead to diabetes. So again, not a question, more an agreement. Christine Marsh is asking, where's the best source for fruits, veggies, and meats? There is no one best source. Get with your local farmers markets if you've got them. So again, local farmers market would be a good place to visit. There's another website, actually a pretty good one, called localharvest.org, where if you aren't familiar with the local farmers markets or local places to buy produce or food co-ops, localharvest.org, just go there and type in your zip code and it kind of will spit back where all the local co-ops and good places to get locally grown, organic, and seasonally available produce, because that's the best. When it comes to produce, if we can get local grown, seasonally available, organic, that's going to be your best option overall for produce. As far as meats are concerned, again, local farms are a great place to go where you can talk to the farmer and where you can learn how they're raising the animal. But beyond that, grass-fed, free-range, pastured animals, and as it relates to like chicken or turkey or beef or bison or lamb, and if you're talking about fish, we're looking for the delineation of wild caught. Don't look for sustainable. Sustainable means that that the way that they're raising these fish generally is that they're farm raising them and feeding them GMO corn or soy. And even if they're not feeding them GMO corn or soy, they're feeding them corn and soy, which is not native to a fish's diet. Fish don't jump out of the ocean or rivers to roll around in the corn and soy fields and get their lunch and dinner. It's not native to their diet, and it changes the nature and the chemical content of their meat and makes it much more higher in omega-6 fatty acids, which can lead to or lean toward a person becoming more inflammatory. So it's important to look, when you're looking for fish, look for wild caught. Okay, let's see here. Is it possible? Well, let's see. I am gluten-free, grain-free. So this is Sophia asking, I am gluten-free, grain-free, legume-free, lectin-free as much as possible. Do I need to supplement with thiamine? Yes or no. It's not one of those questions that you need to necessarily supplement with thiamine just because you're free of those particular foods. And for those of you who don't know, thiamine is vitamin B1. Its chemical name is thiamine, and sometimes referred to as thiamine hydrochloride, as it's related to in supplements or on the food labels, where they sometimes add in thiamine. So thiamine being vitamin B1. Now, a low or no grain, no sugar, no dairy, no lectin diet is not necessarily low in thiamine. Thiamine is richly found in muscle tissue and in meats. It's found readily in liver tissue. So if you're eating meats and liver, organ meats, you're still getting thiamine in your diet. The best way, whether or not you can discern whether you need thiamine, is number one, test for it. And the type of testing I recommend is lymphocyte proliferation. It's a functional outcomes test where we can actually look inside your cell to see if your cells are storing adequate quantities of vitamin B1 and seeing whether those quantities of B1 are sufficient enough to allow your cell to function appropriately. If you do blood testing for vitamin B1, blood testing is very misleading and can be very inaccurate unless you're doing, there's a particular type of test for vitamin B1 that is not lymphocyte proliferation. It's an enzyme-based test that can be done. It's a transketolase activity coefficient test. But most doctors have never even heard of that test, so you're probably not going to have very good luck asking your medical doctor to run that kind of test. Although go for it, ask for it, and if they run it and it's low, then yes, you can supplement with thiamine. You can also get thiamine in a good quality multivitamin. Some symptoms of thiamine deficiency can include constipation, irritability, muscle fatigue, brain fog, low energy or lethargy. These are all things that can happen when a person is low in thiamine. The name of the disease state of thiamine deficiency, so if it gets bad enough, that's actually called beriberi. So if you want to look that up, look up thiamine deficiency or beriberi. You can learn a little bit more about that particular condition and whether or not your symptoms might match up with that. And then from there, you can, better guide yourself on whether or not thiamine supplementation might be appropriate for yourself. So hopefully that answers your question. Somebody's chiming in. Matt is saying benfotiamine is much better. Benfotiamine is a fat-soluble version of vitamin B1, and it's not necessarily better than water-soluble B1. It's different, and they're both functionally important. So it's not that one is better than the other. It's just that one is different than the other. Randall, what about alfalfa sprouts? In my book, No Grain, No Pain, I talk about sprouts being okay. Yes, alfalfa sprouts are okay, the sprout themselves, but not the bean around it. So, if you're doing like sprouts themselves, that's the little stem and the little leaf aspect that grows out of the bean. So the sprouts themselves are okay, and a lot of stores actually sell the sprouts that you can get, just the sprouts themselves. Carolina. Hi, Dr. Osborne. Following your guidance, my life turned around for the best. Thank you for all that you do. Oh, well, thank you, Carolina. Thank you so much for chiming in and saying that. I appreciate that, and I'm so glad that my advice could help you and get you moving in the right direction. Diane McCone is asking, hi, how can we educate other FM docs, functional medicine docs, and practitioners about all grains containing gluten? Especially think that Dr. Tom O'Brien confuses people when he says gluten isn't bad for you. Bad gluten is bad for you. What the heck does that mean? Thank you for your expertise on the subject. I don't know that we're going to convince all doctors that all grains contain gluten that are detrimental. This is an area, I've never seen a patient that had kind of a full-blown autoimmune problem recover fully without giving grains up if they were gluten sensitive. Meaning in the proper way to measure for gluten sensitivity, there's genetic testing that can be done that helps us to identify whether or not a person is going to react to gluten. A lot of these antibody tests that a lot of functional medicine doctors run to see if somebody's reacting to gluten, they can be misleading and they can be misconstrued because, one, they're only measuring IgG or IgA, which are 2 of 7 ways the immune system can have a reaction. But they're also not taking into consideration the fact that there are 1,000+ different forms of gluten, and if we're only measuring 13 or 14 different forms and we're only measuring 2 of 7 ways the immune system can respond, then we're not really being comprehensively accurate. So if the test comes back negative, it doesn't mean you shouldn't avoid gluten. It just means negative as to what was measured, and that's where a lot of the confusion comes in. Well, the best way, Diane, to get doctors to train, we do have at glutenfreesociety.org, we have a practitioner training program. It's a 10-hour course. This course is actually, we actually have, I'm on the Functional Medicine University's advisory board, and we actually offer this course to practitioners who are going through that training. So hundreds of doctors have actually gone through that training already, but we also offer it to other functional medicine docs. But they have to want to come and take it. In essence, we can't force them to take it. It's not part of the curriculum of the schooling that they go through. they have to have a desire to learn more. They have to have a desire to get educated and learn more about gluten. So if you want to help us spread that message, we're happy that you would do that. Just send doctors to glutenfreesociety.org. There's a tab at the top of the menu that says gluten-free doctors, and if they click on that link, they can learn more about our functional medicine practitioners course. Again, that's a 10-hour postgraduate course. Anita Humphreys is asking me about my thoughts on monk fruit. I don't mind monk fruit. I don't like any sweetener in mass as a staple food in the diet. I don't think you should just go and try to replace everything that you sweeten with sugar or any other form of sweetener with some other new form of sweetener. But occasional use of monk fruit is not typically problematic in patients who are trying to move forward. Okay, looks like I'm just trying to scroll through all the questions and make sure that we're getting them all answered appropriately. Barbara's chiming in. She breaks out in red bumps when she eats gluten. A lot of people do. Skin reactions are not an uncommon symptom of an allergic response to food when you eat it. So we get frequently we have clients and customers that come through our clinic that have a similar type of reaction as it relates to gluten exposure. Okay. We're going to take a couple more minutes and answer a few more questions before we wrap up. Is functional medicine a branch of and accepted in the medical community in the U.S.? Great question. I hope I don't say your name wrong, but I might, and if I do, I apologize. Piotr. Is functional medicine a branch of and accepted in the medical community in the U.S.? Depends on which medical community you're talking about. If you're talking about traditional medicine, probably not. It's not an accepted branch. It's not acclaimed across all fields of medicine. It's not taught in medical school as a fundamental. Neither is nutrition, which is basically what functional medicine is. Functional medicine, in a nutshell, is applied nutrition and applied lifestyle. So if we really ask what define functional medicine, what does that really mean? It's really the term functional medicine is really, to me, it's a misnomer, because functional medicine has nothing to do with the practice of medicine. The practice of medicine is the attempt of diagnosing and treating disease with either the artificial chemical manipulation using medicines or with surgical interventions. That's what the practice of medicine is. In a nutshell, functional medicine is the complete opposite of that. We're not trying to diagnose disease. We're certainly not trying to treat disease. We're trying to intelligently sit down with a client and ask the fundamental question: what happened in their body that's led to the disruption of their normal systems and led to their dis-ease, not disease, but dis-ease, meaning why is their body breaking down fundamentally? Why is it not working? And what happened, and what can they do to make changes in their lifestyle to improve upon that? That's not medicine at all. So to answer your question, no, lifestyle medicine or lifestyle intervention or we could call it functional medicine is probably not recognized by mainstream. It certainly isn't taught by mainstream, although a lot of mainstream doctors have a great appreciation for it. And I work with a lot of mainstream doctors. We refer patients back and forth with each other because there are sometimes needs for medication. There are sometimes needs for surgical intervention. There are sometimes needs for acute management of patients. And so that's where medicine can really shine. But in functional medicine, most people's problems, if it's a chronic degenerative issue, can be resolved by lifestyle interventions, And when I say lifestyle interventions, there's really 7 primary lifestyle interventions that can be partaken of. And one of them is obviously diet. It's dialing in what the diet should be versus what the diet is. One of them is sleep. One of them is sunshine, getting adequate sunshine. There's also breathing clean air, drinking clean water. There's stress management. There's love, and there's the emotional connection to other humans. These are all functional medicine lifestyle intervention that need to really be addressed and really be looked at if we're going to truly seek health in a patient or helping a patient restore their health. Great question. Okay, the more questions are rolling in here. Is there somewhere I can find a list of all the items that contain gluten? Yeah, absolutely. The best place to look for that list is this website. I'm going to plug this website in for you, uh, www.glutenfreesociety.org is that website. If you visit that website, there's a tab on the first page that tells you which foods contain gluten. If you click the link, you'll go right to it. And there's a master list that we update once a month based on research because sometimes things change. There are also a list in that of foods that can act like gluten or foods that can mimic gluten. So it's a very comprehensive list that might help you quite a bit. Thanks for the question, Vicki. Anita Gaffney is asking, was told I have the gene for celiac, but in testing was found to have lymphocytic colitis instead. Have been gluten-free for over 2 years, but it really hasn't helped. Any tips? Well, Anita, I would just simply say, I would ask the question, have you really been gluten-free? Have you been true gluten-free? Meaning, have you been avoiding wheat, barley, and rye? Or have you been avoiding all grain? Because to truly be gluten-free, you have to be off of all grain. Wheat, barley, rye, oats, corn, sorghum, millet, teff, triticale, all those things contain different forms of gluten. And it's my experience that people who go traditional gluten-free, meaning they only avoid wheat, barley, and rye, tend to have persistent problems and tend not to heal. As a matter of fact, some studies show as many as 92% of people going on a traditional gluten-free diet, as defined by wheat, barley, and rye, being the grains that contain gluten, do not make a recovery and have persistent inflammation and have persistent damage in their GI tract. So Anita, the first thing I would have you do, go to glutenfreesociety.org, check out the Glutenology Health Matrix. There's about 20 hours of video tutorials there, and if you follow through with that, it'll probably be very helpful for you. The other thing you can do is read my book, No Grain, No Pain, as it kind of maps out what these definitions are, and it's going to help give you a better understanding of what to be doing. It's a great question, and thanks for chiming in. Michelle is asking, have I heard that rice has arsenic levels? So the gluten-free diet that celiacs use, replacing wheat with rice, means we could get high arsenic levels. Yeah, I have heard of that. I actually wrote extensively on that in No Grain, No Pain, as well as on glutenfreesociety.org. So again, if you type in gluten-free society and type in rice, or type in, is rice safe on a gluten-free diet, you're going to find the research that backs that up. It's not just arsenic, and I see this very regularly in people who come to see me. I also see high rice consumers having high levels of cadmium toxicity. Cadmium can displace calcium and magnesium and zinc, and can actually mimic the deficiencies of those minerals. And when it's displacing those minerals, it can create all kinds of health issues. Calcium deficiency can cause neurological problems. It can cause blood pressure problems. It can cause bone loss problems. It can cause cramping and muscle spasms and muscle twitching. It can cause problems with how your brain relays the neurological message from one brain cell to another brain cell, and so it can lead to memory fatigue and brain fog and clouded sensorium and other problems. So yes, good point. Those of you who think that you're following a gluten-free diet but just replacing wheat, barley, and rye with high loads of rice, yes, you're getting high levels of arsenic. Yes, you're getting high levels of cadmium, even if you're eating organic rice, even if you're eating brown rice, even if you're eating sprouted rice. So just be aware of that. If you're using those foods, you should probably reevaluate it. Randall is asking, I have a friend who is 52 and she looks like she's 90. Is this mostly a diet gluten concern? She has had chemo and now has biweekly blood transfusions. She has 3 autoimmune diseases. But that's a tough question to answer because I don't know much about your friend beyond the fact that she's 52 and looks like she's 90. I mean, if she's had cancer and gone through chemo is going to age a person dramatically. I've got firsthand experience, in watching people deteriorate from chemo. So it's very possible she looks 90 because she's gone through chemo, but it's also possible she looks 90 because maybe in the whole process of developing autoimmune disease and cancer, she's made some poor lifestyle choices that have led her body to a quicker deterioration and a faster aging process. So, I mean, first things first, I would just encourage your friend to find some guidance around the arena of nutrition, to find some guidance around the arena of lifestyle medicine, so that she can start making a comeback. Teresa McDonald is asking, can beta cells be regenerated through diet and vitamins? And what are my thoughts on homeopathy? Cephalindra is said to lower blood sugar levels. Look, I don't believe in lowering blood sugar levels with any chemicals, and that includes homeopathic remedies, and that includes medicines, and that includes any substance that could lower blood sugar artificially as a medicinal. And the reason why is because you can lower your blood sugar on your own. And I'm not talking about type 1 diabetics. I'm talking about somebody who's just trying to intelligently eat better, intelligently exercise. Now, as it relates to can beta cells be regenerated, some studies are now finding that beta cells can be regenerated, although I wouldn't make the claim that I wouldn't go out and make the claim that everyone with type 1 diabetes should start doing implementing certain nutritional protocols and guaranteeing that they're going to have beta cell regeneration, because I don't think we could make that claim or that statement at all. Although, again, there's some studies that are coming out, very interesting studies on vitamin B3, niacin, as offering protective and regenerative effects on beta cells. But again, I would say that there's much more research that needs to be done in this arena before any great dramatic healing claims could be made. However, I've had patients that have come to see me and they were type 1 diabetics, and when they started to change their diet, they had better regulation of their blood sugar, they had better regulation of their insulin, they didn't need as much insulin. But again, I don't think we could make the claim that we would heal type 1 diabetics just as a result of diet change or as a result of using any high dose nutritional supplementation. Good question. Is there a cross reaction between gliadin and other foods? I'm not quite sure, Waleed, that I understand what you mean by that question. Gliadin is the name of one type of gluten found in wheat, barley, and rye. Remember, again, there are about 1,000 different forms of gluten. Can other proteins and other foods have a cross-reactive response that is similar to gliadin? Yes, that has been studied, and we've seen that be the case. An example of that actually is quinoa. Quinoa is a pseudo cereal or a pseudo grain, and I recommend people on the gluten-free diet actually avoid quinoa because it can cross-react and it can mimic gluten, and it can cause an immunological response in people with gluten sensitivity. Other foods that we've seen do it, there are a lot of other foods that we've seen do it, but one of the main ones is probably coffee. Coffee's been shown to have a cross-reactivity, more specifically processed coffee, not pure whole coffee bean, but processed coffee where the beans themselves have been highly processed and chemically manipulated. There's another enzyme treatment that's done with food. It's called microbial transglutaminase, or MTG. When you add MTG or processed food with MTG, and this is done with lunch meats, this is done with if you go eat at fast food, a lot of your fast food restaurants use MTG to make the chicken breast or to make the meats. It's also done with a lot of dairy products. You get cross-reactivity, or you get what's like a gluten-like reaction when foods are industrially processed with microbial transglutaminase. Again, this is an enzyme. It's commonly used in food processing, and when you add it to different foods, you get a gluten-like reaction. And I've written about this extensively, both on Gluten Free Society as well in my book, No Grain, No Pain. Crystal's chiming in. Gluten-free has made my diabetes much better. It's non-exident. I would assume you mean non-existent. Well, that's great news, Crystal. Thanks for sharing that testimonial to the audience. Let's see here. Mirna Schaefer, is treatment-resistant SIBO a direct correlate to gluten sensitivity? It can be. And then when you say treatment-resistant SIBO, it's hard to understand what you mean. My experience in that realm is that when somebody says they have treatment resistance, meaning that their doctor probably prescribed them an antibiotic. SIBO stands for small intestinal bacterial overgrowth, for those of you who don't know what SIBO is. And one of the more common prescriptive treatments that medical doctors would recommend is rifaximin, which is a type of antibiotic. So if you've gone on a course or 2 or 3 courses of that type of antibiotic and the SIBO did not clear, yeah, it can relate to gluten sensitivity, because gluten can alter the gut microbiome and it can allow for small intestinal bacterial overgrowth to continue to flourish. So it can be related, not necessarily that it always is related. I've seen cases where people were fully grain-free but still struggled to try to overcome SIBO. So it can be related, but it doesn't have to be. Um, if you're eating grain-free but not super careful, and you know that you're gluten sensitive, you need to get it. You need to get serious about your diet. If you're gluten sensitive and you're not careful, and you're getting gluten cross contamination, and you're getting that 20 parts per million on a regular basis in your diet, you're going to struggle, and you're going to continue to have problems. We know that, the size of a breadcrumb of gluten. I mean, that's one crumb, right? That size can cause inflammation for as much as 2 months in a person. So if you're cheating once a week, you're really self-sabotaging. So I'd encourage you to get your diet dialed in. Caro Almonte is asking if I would recommend the food sensitivity test. She has a 1.5-year-old toddler who's been constipated since she was 6 months, been to many doctors, and the only thing they said is that she's probably allergic to milk. Yeah, I would absolutely recommend testing, because otherwise you're just guessing. And depending on whether or not you're breastfeeding this baby, or breastfeeding is done at this point. I mean, breast milk is one of the best foods. So if in the case of breastfeeding, if you're breastfeeding, you should be tested for allergies, so that you can avoid allergens, so that those aren't showing up in your breast milk, irritating your baby. But also, if your baby's really struggling, it wouldn't be a bad idea to have your baby tested, so that you would know directly what they're reactive to. So again, you could dial the diet in, and you could potentially resolve or help to resolve the issue. Good question. Diane McCone, hi again. Are you familiar with the product Restore? I don't really like to comment on other people's products, good or bad. I mean, and the reason why is that one product might contain 50 or 60 different ingredients, or 5 ingredients, or 2 ingredients. I can't make statements or make claims as to where those ingredients were sourced, how they were sourced, how meticulous the manufacturer was, whether or not it's pharmaceutical grade, what kind of testing that company did when they were putting the product together in terms of making sure it was metal-free and contaminant-free. So I really can't comment on that company, because I don't know enough about them, and I don't want to say anything bad about them or derogatory or negative about them. I can comment on the products that I have designed and that I have put together. And if you want to go and read more about those, you can go to glutenfreesociety.org, and there's a store there where we specialize in creating high quality pharmaceutical grade supplements that people can take, and we know they're grain free. That's part of what we are about, is making sure that people can get safe, effective supplements that are grain free. So I can speak to the integrity of my own product, but I don't really like to make comments about other people's, because I can't control the ingredients or the sourcing or the manufacturing, and don't know enough about them to really comment intelligently. Christy's asking, sounds like in order to be wheat, barley, and rye free due to celiac disease with a problem with zinc, copper, vitamin D levels really low, sounds like I need to only eat out of my garden. Sincerely, a person with the celiac curse. Well, first of all, I want to put things into perspective differently, Christy. You don't have a celiac curse. You have the gift of knowing that if you change your diet, you can restore your health. That's a blessing. So let's just kind of reverse engineer the way that your mind and that your psychology is looking at this, because healing starts with your head, starts in the mind. Second of all, if you're eating out, and you're eating out in a bunch of food restaurants that have the potential for cross-contamination and gluten exposure, it means that you might want to not necessarily eat food just directly out of your own garden, although if you want to grow your own garden, that's a least expensive way to go about having really healthy, fresh, whole, seasonal available foods. But you can go to the grocery store and you can purchase from the grocery store. A lot of people will make the claim that it's more expensive to buy organic whole foods than it is to eat out. I would say, unless you're eating out at 99-cent menus at Taco Bell and McDonald's, that's just not true. It's a lot cheaper to make real food, because you don't have a healthcare expenditure, you don't have a chronic medical bill, you don't have to stay on medications for the rest of your life, paying co-pays and visiting doctors and everything else. I mean, the number one cause of bankruptcy in the U.S. alone is medical bills. So I would make the claim that eating real food and growing food out of your own garden, and knowing that if you do that, you're going to be much more financially secure and much more healthy, I would say that's a blessing, not a curse. Just my 2 cents. Stephanie's asking, I have a celiac gene, a sister with confirmed celiac disease, gluten sensitivity, GERD, hiatal hernia, IBS, history of colon and stomach polyps, MTHFR mutation, and many food sensitivities and suspected leaky gut. I honestly don't know where to start to heal my gut. Stephanie, don't go it alone. Go find a good functional medicine doc and get help. Going it alone is that can be a very frustrating ordeal, and you may do a lot of things right, but you may guess a lot right. Like you may follow somebody's diet protocol or try an elimination diet, but if you're missing the mark or you're getting some things wrong, you can struggle a really long time. So go find some professional help and really get this thing figured out, because a good experienced functional medicine doctor is worth their weight in gold. I mean, literally, they can help transform your life in a matter of months versus you trying to struggle and try to figure this thing out and piecemeal it together over time. I would highly recommend you seek out some professional help. Let's see here. Jim, I just got your book. Looking forward to reading it. Thanks, Jim. Thanks for your support. Thanks for buying the book. I hope it helps you. I hope it helps transform your life. Teresa's asking, should probiotics be taken permanently if they are seen to reduce blood sugar levels? I don't think we could make the claim that any supplement needs to be taken permanently. I mean, we could, but I don't know that it's necessarily true. And I think it's unique to the person, unique to the individual. Probiotics, depending on which chains or strains that you're taking, depending on the state of your current microbiome, depending on your diet, depending on your lifestyle behaviors, depending on your exercise. I mean, there's a lot that can affect your blood sugar levels. So I don't know that we would just say taking a probiotic for the rest of your life is the solution to keeping your blood sugar levels in check, although it could be a tool to help do that. It could be a tool to help support your microbiome. I would say if that's the only thing that you're doing to maintain or to regulate your blood sugar, you probably ought to look at other lifestyle components that could also help you. Marcy's asking, I will agree that the gluten-free way isn't for everybody, but there are those of us who have, well, that's not really a question. Let's see. Is there any other safe sweetener besides stevia if you have a fructose allergy? Well, first of all, you can't have a fructose allergy. Fructose is an essential sugar. You can be fructose intolerant, meaning your body doesn't process fructose very well, and so it puts more stress on your liver. And if that's the case, if you've got a fructose intolerance, again, not an allergy, intolerance, you might have a doctor measure your copper levels, because copper deficiency can cause fructose intolerance. And you might be able to tolerate some fructose just fine if you get that looked at and get that corrected. But beyond that, other sweeteners. So to answer your question, monk fruit is not really going to impact fructose as a sweetener. Stevia is a good option. Sugar alcohols like xylitol, as long as they're birchwood derived and not corn derived, is another good option. Okay, so next question, Diane is asking, what would your 3 tips be for all of us to be healthy as selves? That's kind of a loaded question there, because there aren't just 3 things. But I would say, look, if we're going to say what are the 3 big factors, eat real food, exercise regularly, okay, sleep enough hours at the right time, which is generally go to bed when the sun goes down and wake up when the sun comes up, get as close to that as possible. Have love and the Lord and laughter in your life. I mean, those are all critical. You can't take one of those things away and expect a person to be in good health. So I would say focus on all of those things and ask yourself, how can I do better in all of those arenas every day? Okay, we're running out of time. So I'm going to take these next 2, and then I got to wrap it up. Danielle's asking, got diagnosed with celiac disease 2.5 years ago, still yo-yoing with weight. Is this normal, or should I look at getting my thyroid checked? Well, it's not a bad idea. It just depends on how bad you're yo-yoing with weight. I mean, there are a lot of reasons why weight loss or weight gain can occur, and that could have a lot to do with celiac disease depending on where your diet is. But it could be that you have some key nutritional deficiencies that aren't allowing your metabolism to be dialed in as well. It could be that you need to look at exercise and the kind of exercise that you're doing. So it may not have anything to do so much with your diet. It could also have to do with other lifestyle factors. People yo-yo with weight when they work shifts. People yo-yo with weight if they don't get enough sleep. People yo-yo with weight if they do long bouts of cardio, but they don't have muscle training or high intensity interval exercise training as a platform for their daily exercise. So it's not a bad idea to have your thyroid checked. You could get with a good endocrinologist, or you can get with a good functional medicine doc and have them dial in your thyroid, but don't just have them measure your TSH. What I would say, if you ask your doctor to measure your TSH, your T3, your T4, both free and bound, I would have them measure your reverse T3. I would have them measure your iodine through an iodine loading test. I would have them measure halides. Halides are measuring chlorine, bromine, and fluoride, because those can interfere with iodine, and iodine is necessary for your thyroid to function. Have them measure your vitamin B12, your magnesium, your zinc, your vitamin B2, your vitamin C, your omega-3 fatty acids, your vitamin A, your vitamin D, and your iron, because those are the nutrients that are necessary for your body to properly metabolize your thyroid hormone, and to properly metabolize your hormones and your hormone interaction. Another live cast, but you can also go to Gluten Free Society and type in the search engine, type in thyroid and nutrition, and there's some great articles I've written on that topic. So including a list of the different lab tests that can be done that you can ask your doctor for. Okay, I've got to wrap it up, ladies and gents. I appreciate you taking time out of your Friday to be with me, and I really am enjoying these live casts. I think I'm going to keep doing them. So stay tuned. Next Friday, we're going to dial this in again at 1:30. We're going to do another live cast. So mark your calendar, and I will see you next Friday. Until then, have a great day, and I hope your weekend is wonderful.